Assalamu alaikum. My name is Dr.haroon and I'm a public health specialist and a clinician too. I'm going to conduct a study which is very interesting study through which we can assess the pediatric patients and their prognosis, as well as the condition which is very much treatable, but its early diagnosis is mandatory. So the title of my study is the anatomical characterization of ventricular septal defect using high resolution CT scan among the pediatric congenital heart disease. It's a cross-sectional study, and I will be conducting this study in the tertiary care hospital in Peshawar. So what's a congenital heart disease? It's actually a structural defects of the heart create vessels present at birth, leading cause of infant mortality and morbidity. Global prevalence is about 8 to 12 per 1,000 live births. And early detection reduces the disease burden, so it's so important. You can imagine improves long-term outcomes and survival. And the ventricular septal defect is the most common congenital heart disease defect, which counts for 30 to 40% of the congenital heart disease cases. It involves abnormal opening in interventricular septum, causes left to right shunt, increases the pulmonary flow, and causes ultimately the heart failure. There are many types of VSD, like perimembranous muscular inlet outlet, which is usually called the supracrystal. What are the clinical presentation of the patients like? The patient with a small VSD often are asymptomatic, may close spontaneously. The large are the patients which are symptomatic and feeding difficulties, poor growth, and recurrent infections. What are the diagnostic tools? These are the echocardiography, which is the first line obviously, and in high setups we can use the CT for detailed assessment. Why I'm doing this study, what is the reason behind it, is that there are very limited regional and institutional data, and especially in low and middle income countries, and the advanced imaging offers precise anatomical insights, which supports better surgical planning and health resource allocation in our setups, like we are the low and middle income countries. So what will be the rationale of my study? The rationale of my study will be that VSD is the most common congenital heart defect, but detailed regional data is very scanty, and high resolution CT imaging offers precise anatomical visualization. Yet its use in local pediatric population is limited. This study aims to fill that gap, enhancing diagnostic accuracy and guiding better clinical and surgical management. And what are the objectives of this study? That to characterize the anatomical features of ventricular septal defect using the higher resolution CT scan in pediatric patients with congenital heart disease at the tertiary care hospital at Peshawar. Now coming to the word a little bit more detailed, like congenital heart disease is an structural and functional cardiac abnormality present at birth, resulting from improper development of the heart or major blood vessels during embryogenesis. Diagnoses are confirmed through the echocardiography, surgical findings, and the imaging studies. Now coming to the ventricular septal defects, it's a congenital defect characterized by one or more abnormal openings in the interventricular septum, allowing direct communication between the right and the left ventricles, which is classified based on the anatomical location into perimembranous muscular inlet and the outlet types. What will be the study's design of my study? It is obviously a cross-sectional and descriptive study with the duration will be 6 months, and I will be doing it in the tertiary care hospitals. Like the patients, children aged from 0 to 16 years diagnosed with the congenital heart defect during this period will be included into my study. Likewise, the patient with the complete and accessible medical and imaging records, and children with the confirmed diagnosis of the ventricular septal defect of any anatomical type, which I have earlier told you there are four other types based on diagnostic modality, such as transthoracic echocardiography and CD angiography. Who are the patients which will be excluded are a patient with acute heart defects such as post-infective or traumatic septal defects, children with the acquired ventricular septal defects such as post-traumatic VSDs or those secondary to infective endocarditis and myocardial infarctions. Patients with incomplete or missing diagnostic data such as absent echocardiography or unclear reports, and cases in which the consent for the guardians or parent for use of the patient data is not available. Based on estimated prevalence from the previous literature, 16% VSD among the CSDs. Okay, and so what will be the sample size of this study is 196 patients. This was all about the was the stuff what I am going to do in my setup. So hope so if I get the good outcome and we can have a better prognosis of the patients which are early diagnosis. So it will be a very good study to improve our practice as well as the finding the patient at its early stages and treating it with the most advanced technology and treatment. Thank you for listening, and if you have any queries and questions you can ask. Thank you.